We are going to talk about, as I said, metabolic health and the brain. And there's so much going on in terms of how GLP-1s impact the brain. We talk in here a lot about food noise. How do GLP-1s and related medications change how we actually taste foods? Does it make sweet and salty more intense and we crave different foods? Does it change shopping behavior? We know it changes addictive behavior. So it's going to change how we eat and what we choose to eat. And then GLP-1s actually cross the brain barrier and like have impacts on inflammation. I showed earlier that there's an indication in process for Alzheimer's. So I'm really excited to have three experts on this topic up here with me. I will let them introduce themselves, but I'll give a brief pre-intro. Professor Ameer Taha will discuss the direct link between metabolic hormones like GLP-1s, brain health, and long-term cognitive outcomes like dementia. So he has done research on how what we eat impacts our brains, and I think that's going to be really fascinating. Next, Professor Julien Delarue, I'm excited to have up here. He is our expert here at UC Davis on taste and texture and aroma, and works with companies on product design to really optimize food so that people love it. And then Dr. Caitlyn Edwards, I'm really excited to meet here today. We'll be talking about diet and emotional states, what people are craving, how is behavior changing. She is a senior research scientist at AG1, has also worked with patients, designed clinical studies, and has published widely on how what we eat can affect our cognition and memory. So with that, I will turn it over to Ameer Taha to talk about his area of expertise. Thank
you, Kim. I think I actually plagiarized the slide from Julien. So 20 years ago, or roughly 20% into 100 ages ago, when I was doing my master's, I think I keep remembering that actually the focus of how GLP-1 works on the brain was through the hypothalamus, through promoting satiety and insulin secretion and so forth. But then it became clear that it's not just the hypothalamus. There's other areas of the brain that are affected by these GLP agonists and GLP-1, and they're interconnected. So what you see here is a beautiful slide that Julien pulled, which I'm plagiarizing happily. It literally shows you, it all starts with the olfactory bulb. So that's where sensory comes in. But look at how it connects to places like the amygdala, the AM, and then the hippocampus, LH, left hippocampus, right? And this is where hypotheses related to how these things act on sensory, potentially amygdala, which is where we feel things. So our perception of food and taste and feelings, overall feelings and well-being, that's this little, almond-like structure in the brain called the amygdala. And it heavily interfaces with the hippocampus, which is involved in learning and memory. So I'm really thrilled by how, where we've gone from 20 years ago to now, where the focus was how do these things affect hunger, satiety, and so forth. There were incretins, they're involved in the postprandial food response or response to food. But now we're actually talking about mechanisms and brain circuitries that encompass sensory, that encompass learning and memory, that encompass feelings, emotions. And it's really a good time to be in this field. So I'll stop here and pass it on to Julien to weigh in on the sensory part.
Great, thank you. There's a lot of circuitry here, so I just highlighted the pathways, the neural pathways for taste and for smell, so you can better see it. And as you can see, like they're all project to the limbic system first, and which is something very important. Maybe we'll discuss that again. What I want to highlight here is the locations where GLP-1 receptors have been found. So they're literally everywhere where those neural information coming from taste and smell are transit or are treated. So we may really expect some interferences with taste and smell. And so there are very few studies. But what I would like to share with you is relatively new data that were presented last month. And this is not from a clinical study. This is not my data. These are from the FDA database. So these are the adverse events reported by consumers and GLP-1 users on the top part of the chart here. So we can see when the dots are shifted to the right, it means that there are some adverse effects reported for taste, dysphagia, taste disorder without anything specified, and parosmia, so disorders with the smell. So you can see that there are some disorders or some events that have been reported, but they are not very strong. So that's interesting. And it's mostly about taste rather than smell. And probably one reason for that is that it's easier for consumers, people that have not been trained on describing their senses or their perception to describe changes in their taste than in their smell or sense of olfaction, which is a bit more complex. But these effects are still relatively small compared with other drugs that are known to affect taste and smell. So this is the first thing that I wanted to share with you because we often get the question. And then something else, I'm going to switch to something completely different now because so I study food behavior. And so my background is a sensory food scientist. So of course I would focus on the food and on the recipes and how to make food, delicious. But we know, and this is a very famous model of the determinants of food behaviors. And what you can see here is that it's complex. There are multiple determinants of food behavior. And so just to simplify this, you can see here, of course, today we're interested in the biological and physiological factors. I'm more interested in the characteristics of the food itself, but there are so many other components, psychological factors, context, situational factors, social cultural factors, and of course, everything that is extrinsic to the food itself, the labeling, we mentioned claims, in labeling, food expectations are all very important. But what we actually know is very little. I mean, to be honest, we know very little about food behavior. We know that all these factors play a role, but no one can really tell you, like, this is how much this factor interact with this other factor to affect behavior. We know a little bit about it. So I think that I agree with all the other speakers that we're living a tremendous time, and it's very exciting because of these changes in behaviors, we're probably going to learn more about these different effects. And I will keep more for the discussion. Maybe I will pass the mic.
Hi, everyone. My name is Caitlyn Edwards. I'm a senior research scientist at AG1. And outside of AG1, I'm also a registered dietitian. And I work with patients who are on GLP-1 medications and help them manage their nutrition needs. And so the goal of my presentation today was talk a little bit about the patient perspective and the science around this emerging theme of changes in food-related cognition that has actually been brought up a number of times today, and that is food noise. So set the scene a little bit. If you are one of the 57% of people who report experiencing food noise, you might find yourself having some of these thoughts throughout the day. I'm saying, I'm constantly thinking about food. I'm always planning my next meal. I'm always thinking about the last. Or even at one end of the spectrum, finding that food has taken over my life. And GLP-1s have brought food noise to the front and center of the conversation about weight management. And it's not that food noise is necessarily a new term. We've been studying this in the literature for quite some time under different names. But what happened is that as more and more patients had access to GLP-1 medications for weight loss, we began hearing more and more anecdotal reports of a quieting, of a dampening, sometimes a complete elimination of these really intrusive thoughts about food that many people had just been living with for most of their life. And so the patients, media, and honestly, even Oprah had a hand in coining the term food noise. And then it took the research a little bit longer to catch up. And so it wasn't until 2023, just a short 2 years ago, that my previous group at Penn State under Dr. Travis Masterson, we published the first scientific definition of food noise, where we formally defined food noise as heightened and or persistent food-related intrusive thoughts and maladaptive eating behaviors. And so over the last 2 years, we've learned a lot about what food noise actually is and what patients are experiencing, but there is still so much for us to learn. And I think the question for those of us in this room is potentially, how are changes in food-related cognitions impacting daily eating and buying behaviors? Unfortunately, I'm not up here with like the silver bullet answer for that. There's still a lot to learn, but I think in true food noise fashion, what I want to do is I want to ground the answer to that question in the patient experience. And so I want to highlight some of my experience with patients reporting their changes in food-related cognitions before and after taking a GLP-1. Had a patient who was experiencing severe GI side effects. She said, I would rather deal with nausea and vomiting every single day for the rest of my life than have to go back to dealing with food noise. Another patient who had really high food noise before starting a GLP-1 said, I have never missed a meal in my life, and now I am actually finding myself forgetting to eat. And then this is not a patient of mine. This is a published quote that is used widely about food noise, but I really enjoy it. It says, all of a sudden, it was like some part of my brain that was always there just went quiet. It felt almost surreal to put an injector against my leg and have happen in 48 hours what decades of intervention could not accomplish. If I had lost almost no weight just to have my brain working the way it's working, I would stay on this medication forever. And so changes in food-related cognition of this magnitude are likely to have profound effects on daily dietary intake and buying behaviors. And so I'm excited to talk about that with the rest of the panel, but I'll leave us with two more quick stats. Weight Watchers and the Stop Obesity Alliance asked GLP-1 users, what has been easier for you since starting a GLP-1? I want to highlight that 76% of people said it was easier for them to make healthy food choices, while 72% said it was easier to stick to their nutrition and exercise routines for weight loss. And so just think about the potential there for services, for products, and the ability to help patients in this place where they are ready to make positive behavior change. So with that.
Wow, those were some really compelling quotes. That's intense. Well, I'm going to start with a question for Ameer. You showed this diagram with a picture of the brain and all of the different places that GLP-1s have an impact. How do you feel like these medications will impact cognition, both apart from people eating differently, as well as sort of combined with the nutritional changes?
Yeah, so I'll start with the first question on how these medications may impact cognition. The keyword is may. The evidence is still coming out. I know, 20 years ago, there was a lot of studies showing that, blood GLP-1 levels relate to memory, learning and memory capacity. And now there's ongoing trials in Alzheimer's to look at how these drugs affect Alzheimer's dementia. And I think there's going to be more questions on other types of opportunities for other types of dementia. So Alzheimer's is one, but another one is vascular dementia, which is very common. One wonders about Lewy body dementia. So there's many questions and lots of answers to be pursued here. But in terms of the mechanism, we're still learning that. I mean, we're studying lipid-mediated inflammatory mechanisms with these drugs in humans. But one underlying mechanism, and I suspect this is why they're trying it in Alzheimer's, is the inflammation pathway, which underlies Alzheimer's dementia. So that's one pathway. Another one, which is actually, which I'm excited about, is relates to the fact, and it wasn't shown on that beautiful slide, but there's actually GLP-1 receptors in the vasculature of the brain. And these drugs, I think Bob was saying earlier, in the kidneys, they mediate blood flow. So in the brain, they likely do something similar. And where do you want blood flow to be flowing in the brain? Well, you do want it to be flowing in the brain, of course, but especially in situations where you are at risk of vascular dementia, right? That's why, preventable risk factors like hypertension and high cholesterol, or high blood sugar even, all of these things diminish the risk of vascular dementia. So I'm excited to I'm excited. I mean, this is something actually we're studying also. Excited by the opportunity to explore how these drugs affect blood flow through these receptors on the vasculature that could take blood to where it needs to go so that you can deliver just key nutrients, oxygen, because that's the problem with vascular dementia. It's the dementia related to defective vasculature in the brain. So the brain isn't getting what it needs in terms of nutrients and oxygen. How do you diagnose it? You have these things called white matter hyperintensities in an MRI. Do you know what that is? It's holes in the brain. It's suffocating neurons that are dying. So if we're able to rescue these, get the blood there somehow through these drugs, I mean, that would be phenomenal in my view. And that's why I say we need to look at other types of dementia. It's a heterogeneous condition. So, people talk about cognitive impairment, but there's many types of cognitive impairment, right? So I think down the line, we need to fine tune what we mean and which one these drugs target. And this will inform on which people would benefit from them most. And then the other question was in terms of food and
like if they impact cognition generally, but then you're also eating more healthfully, is there can you separate these impacts or combine them or?
Yeah, so I think the previous panels, there needs to be a little bit more work done there. I am for the hypothesis that, what you eat, I mean, the data are clear. There is modification in food eating behavior, and that makes sense just based on the diagram I was showing as to how these, brain structures involved in feeding behavior and learning and memory and sensory are coupled to each other. They're just literally coupled both by the prevalence of GLP-1 receptors there and the circuitries that connect them. So it does make sense that there's an opportunity for food to modify or this GLP-1 interaction or vice versa to optimize effects or to potentially deal with the side effects, which was also discussed in the previous panel.
Oh, fascinating. All right, question for Julien. You showed this diagram. You called it food taste adverse effects. And I noticed two things on there. One is I don't know what a taste adverse effect is. Does that mean it's changing how you taste things? And why is it adverse? And then if you can maybe explain that to everybody. And then a second point of that, I noticed on that diagram that it said it showed the adverse effect with semaglutide, but not with tirzepatide, which I think we're going to see more people taking because it's a combination drug that is more effective with lower side effects. So is this not something that happens with tirzepatide? Is it just with the Ozempics of the world? And then, if you can just go into that a little more. It was a really interesting chart.
Yeah, these adverse effects are reported by users or patients, and there could be all sorts of disorders. The most common is loss or lowered taste sensitivity, but sometimes people experience this different, they have the perception that their taste sensations are kind of mixed up, and same for smell. So that's something that some people may have experienced with COVID. So there was also questions with this data if there were potentially confounding effects with COVID, but the researchers that analyzed this data, they tested this hypothesis and did not find a correlation or a confounding effect of COVID. So I don't know if that answers your question about the first part of the question. And then for the different effect of the different drugs, it's I don't have the answer to that question. Why? About the why. And this is just the observation of what people reported. And these categories, and just to come back to the first part of the question, the type of adverse effects are reported by people, so they're very simplistic. So they either say they have a taste loss, or there's something wrong with my test, and it's not more detailed than that. So we don't have further explanation or further details about exactly what the perceptions are. Again, these are reported side effects, but it's not a clinical trial. It's not a sensory study.
So I've heard more like, I don't know if this is true, sort of heard it probably in popular media, that when you take these medications, you have a more intense, like you're sort of have an increased taste for like sweet and salty. So you don't want such sweet things. Is that, because what you're saying sounds like the opposite. Is that?
Okay, I've seen conflicting results on that regard. And I think that from what I've seen, people experience different experiences. So you cannot say you will have that. No, it's different people will react completely differently. And that's why these numbers are, although they are significant on that chart, they are not huge. Like some people report that, but it's still small numbers.
Sounds like more research needs to be done for the food
Definitely,
industry to understand it. Yeah, interesting. All right, question for Caitlyn. So your work has highlighted the profound long-term impact of dietary patterns on cognitive aging. GLP therapies are now introducing a completely new dietary pattern in millions of people. From your perspective as a researcher, what are the most critical unanswered questions we should be studying right now to understand the cognitive consequences this new way of eating might have in the next 10 or 20 years?
Such a good question. I think the biggest thing that we need to be doing right now as researchers is understanding what are the exact impacts of these medications on dietary behavior. A lot of what we know is based on assumptions, but there are very few well-designed studies that actually characterize changes before and after a GLP-1 medication and follow patients throughout their GLP-1 journey. And this is concerning for a couple of different angles. The first is that if we do not have the data on what patients are eating, we are not able to iterate on current clinical guidelines to allow us to support patients the best we can. But the second thing is it ties into longevity. And I do think as these medications are becoming more and more popular, we are going to be kicking ourselves as researchers in about 10 years and saying, oh my gosh, why didn't we do a food frequency questionnaire in this population at the beginning? Because we're not going to be able to understand how these long-term changes in dietary impact are impacting long-term health and longevity.
Interesting. All right. I'm going to move another question to Julien, actually, because I didn't get to my initial question after I saw your chart. So I'm going to jump back to my initial question, which was, you noted when we were talking earlier that food preferences now have very little innate wiring and are largely learned, at least today. We've sort of lost our innate wiring for like what we should be eating. Can GLP-1s disrupt the learned neurological patterns of taste and reward that we've spent a lifetime building, bringing us back perhaps to the healthier eating habits of our ancestors? And if so, do you think that can persist after we stop taking a medication?
Well, first, I would like to correct this because we are wired to like sweetness, saltiness, and fattiness. Therefore, all the issues, right? So, but beyond that, everything is, or most of what we like and prefer and choose is learned. And that's very important because we often have that false impression that preferences are something that are fixed. And they're not. Of course, a lot of it is built during the childhood and even before that, during pregnancy. But even like throughout our lives, we still learn and we still build our preferences and disgust. And that's where I think it would be super interesting to know what are the effects of taking GLP-1s on this learning process. And there's a lot of unknown. I don't know if, when you stop taking them, do you go back to what you've learned before? Do you acquire new information and building new preferences while you're having the drugs? And I think we can discuss of what it means in terms of perhaps opportunity to rewire or recalibrate your own preferences. But for me, that's an open question, and I haven't seen any data about that.
Yeah, I think that'll be really interesting. I know personally when I stopped eating very much sugar. Now, like a cherry tomato is like candy, right? Like, can people get rewired in that way from changing their eating habits? I think they can, but it'd be interesting to see what the data plays out with. Ameer, another question for you. So, given that these drugs have direct neuroprotective and anti-inflammatory effects, how can the food industry innovate beyond simply adding protein? What specific functional ingredients or brain healthy nutrients could be used to create foods that actively synergize and amplify these direct neurological benefits?
So I think there is room for innovation here in terms of what really activates these receptors, even from the perspective of small peptides. Um, Again, what's interesting is back in the days when I was a student working on GLP-1, um, the the idea that you can target one receptor and have all these benefits was actually shut down by experts in the field at the time, because postprandially you have, after a meal, you digest lipids, the carbs, everything, and you get the increase in CCK, ghrelin, GLP-1. So there's many things that go up over time and then they go down. And there has been like CCK antagonists. That's also another incretin involved in hunger regulation, ghrelin drugs, and none of them actually worked well. And GLP-1 was the one that worked well. But what I think needs to happen next is looking further into what ticks that receptor. From an agonist perspective, we know the drugs, but there's actually some components in milk, for example, that have been shown to sort of agonize it in a better way. Not so much as the drugs, but they bind it and activate it. So I think there's opportunities for food to innovate and synergistically or by itself work to activate the drug where you need it to be activated, whether it's the brain, the kidneys, or whatever. And then I just want to sort of go back to that first question on the mechanisms. I forgot to state the obvious. One of the mechanisms, and I just assumed you guys know it, it's peripheral regulation of glucose metabolism, right? Of lipid and glucose metabolism, because in the field of cognitive impairment or dementia, if you fix the periphery, you fix the brain. And that's probably the most robust evidence to date on what actually prevents dementia. It's not the drugs, the beta amyloid plaque reducers or the phosphorylated tau reducers. What actually prevents it now, and that's been shown in randomized trials, is dietary and lifestyle factors. So that's one indirect mechanism, I would say, because we're not targeting the brain receptors through which you can have food. These drugs can be working. And I look forward, to the next few years where we look at how they synergize with food. And the last thing I'm going to say is, does anyone know which part of the brain goes away once, if you have Alzheimer's? What part is most affected? What part is wiped out first? Olfactory bulb. The olfactory bulb. Yeah. Olfactory. So, sensory.
Interesting. So much exciting things happen.
Scary.
Yeah, but we're never going to get there now because we're fixing all the problems. So it's okay. So Caitlyn, in planning for this session, you mentioned that our current understanding of the impacts of these drugs is dominated by anecdotal data, and you shared some beautiful anecdotal data, and I love stories. But what do you see as the biggest misconception circulating right now about consumer behavior on GLP-1s, and what specific research do we need to prioritize to separate the, quote, food noise, that's a pun, from scientific fact? Given the current lack of long-term empirical data, how can the food and wellness industries act responsibly? And how can companies innovate and offer guidance and support to this population while acknowledging that there's still, scientific uncertainty?
Pun, by the way. Fantastic pun. Yes. So there is a lot of misconceptions about GLP-1s. And I think the biggest one from my perspective, from the patient and both from the provider and the industry side, is that patients know how to eat healthy. If we prescribe them a GLP-1, they then are going to be able to go out and make the right choices for themselves. But what we're finding is that oftentimes the changes in behavior, the changes in cravings, the changing in food noise are so strong that people are encountering food that tastes differently again for the first time in their life. And so they really need education and support in understanding, how do I build a healthy diet when I'm operating under essentially this state. And so from a research perspective, I think it's very important that we start adding on behavioral components to a lot of these large-scale clinical trials. And there has been a lot of progress in that just recently. We're seeing food noise being added to large-scale pharmaceutical trials to understand changes in food noise across time. And so hopefully that will bring about some change as well. But from a lot of us in this room, we're designing services and we're designing products to support members. And I think the responsible thing for us to do is to make sure that we are interfacing with patients, we are interfacing with providers, and we are listening to people who are on these medications so that we can responsibly innovate in ways that will help them.
I think this goes back to the first panel that Justin moderated, and this service we need at the checkout to, give this kind of support to GLP-1 users. My mother went to get it. She's like, I've been struggling with being overweight my entire life. And the doctor's like, great, here's a GLP-1. And yeah, that's it. There's more we need to do for sure. So I want to open it up to the audience to see if you have any questions. I can ask more questions, but I want to make sure we have time for audience questions as well. If anyone has any questions about the brain and GLP-1s. Bobby here has a question.
It's just a very interesting topic here. I was just kind of wondering, are there specific dietary components that would enhance the off taste, like bitter tasting compounds? Is that known?
Not to my knowledge.
Okay. So I know a number of them potentially stimulate GLP-1 themselves, so I didn't know if that was enhanced.
All right. Well, people think about your questions. Just another question. When people go on GLP-1s, as you've been like in this position of a dietitian and supporting patients, do you feel like most people, without the support necessarily, although if they're coming to you, they're getting a little support, do you think they're naturally saying, oh, I want to completely change my diet and eat more protein and more fiber and more nutrient dense food? Or are they just like, I want to eat fewer potato chips?
Yes, a little bit of both, maybe I'll say. A lot of people, and it depends on the person, see this as an opportunity to, imagine you are someone who has lived with overweight and obesity for your entire life. You have tried things that have failed, it has not been successful, and you have something that works. A lot of times people are so excited by this that it's a chance to finally engage in the health behaviors that they've been wanting to engage in for quite some time. And so a lot of people will show up to a first session and say, I want to be healthy. Teach me how to be healthy. And, it's fantastic that I'm able to see those people, but I always think there are so many people who are just prescribed a GLP-1 from their doctor. Maybe they show up to their appointment 6 weeks later for a weight check-in, but that's all the nutrition education they're getting. So.
And that's super interesting. And I think that it's interesting when you're saying that people are willing to build a better or healthier diet, because one important driver is pleasure. When we're eating food also for pleasure. And yes, we are one of the main determinants of our eating behavior is the internal signaling. So if you change that and suppress the food noise, then maybe there's an opportunity to, again, rewire or rebuild our preference system and build a healthier, but also more pleasurable, more enjoyable diet, which I think would be the key to a more sustainable and or sustain a healthier diet.
Lots of questions. I'll let the people with the microphones decide.
I got a newbie question here, which is, I know that there are olfactive sensors, not just in the brain, but in the rest of the body. What is the food choice hierarchy of those receptors? How do they work together, or are they independent? Does that make sense? We don't know. More research is required.
Yeah, actually, I don't know the answer. Yeah, I don't know. But a good question.
I don't think, or I haven't heard anything saying that the smell receptors or odor receptors that are found in other parts of the body are functional or they connect in the same way as the neuroreceptors in the olfactory bulb. So maybe they act differently. But I don't think they are directly connected. They may serve different functions in the body.
So yeah, two questions. One, I would love to hear each of you or one of whoever wants to comment on just gut-brain axis thoughts. So wide open, but whatever is on your mind there. And then number two, especially for Ameer and Julien, here you are at UC Davis, and if you had an opportunity to design a study that actually was a collaboration between the nutrition department, the food science department, and the medical school, what would be the study that you would want to do in terms of metabolic health in the brain at the intersection of nutrition and GLP-1 drugs?
I'll take the first one, you take the second one. So
it's true collaboration, huh?
So the gut-brain axis, obviously it's a huge topic and it's an emerging field. 10, 15 years ago, they were separate nervous systems, and now, they talk to each other. Awesome. But the whole thing with GLP-1, it all starts with the gut. It's the receptors respond to foods, right? And especially peptides, which that's what activates them. These are the endogenous ligands for these receptors. So, and that's where you get the feeling of, okay, I'm full, and there's right there's the hypothalamic axis where the GLP goes to the hypothalamus and says, all right, you stop eating, but this feeling of fullness is starts in the gut, and I'll weigh in slightly into the second part of the question. What I'd like to see, if you look at how our bodies do it, it's really based on peptides coming from food that activate these receptors. These are the true non-drug agonists, right? And that's how you get, your gut tells you, all right, we're done here. Brain says, stop eating, go to sleep, whatever. So what I'd like to see down the line is innovation or more research on what specific peptides, what I was saying earlier, really agonize these receptors. And a good example, again, is some of the peptides derived from milk. They've been shown to stimulate GLP-1. And that's important during development because babies have a mechanism. This is something you're born with. You're every 2 hours when you're a baby, you're like, okay, I need to eat, right? But then when you're less of a baby, you're like, okay, I'm going to calm down a little because I'm not growing too much. And this changes over time. So there's a temporal regulation of what peptides are being released, how we're responding to it from a GLP-1 perspective, and how it regulates our satiety, hunger, and so forth. And maybe mood and memory as well. But this is what I'd like to see down the line. There's really big room for innovation for a lot of these food-derived peptides in terms of agonizing these receptors and really, maybe not to the extent of a drug, but maybe getting there, right?
I just want to add something to that. I know there's questions outstanding still, but I think there's a lot of work, and I don't even know if it's possible. Maybe it is. But when you eat and the GLP-1 receptors are stimulated, the effect of the GLP-1 is up and down, and it's very quick, and that's why the medications have such impact, because it's a much longer effect. And so getting food to have nearly the impact of the medication is a very big hurdle. And I don't know, maybe it's because the babies eat every hour. It's more impactful. But
Yeah, I mean, the babies do it. I don't know. But yeah, I think with food, you could come to think of long-term chronic effects for, weight maintenance potentially. But you're right. Yeah, the drugs have a longer-term effects than any peptide would offer. And you're right, it's a temporal thing with food. So, but it's more the chronic sustained effects that could synergize potentially with the drug. Or when you get off the drug, can we keep you at where you're at? So with these peptides. So, all right, Julien.
Thank you. So yeah, well, as you understand that there's virtually no data, especially on behavior. I mean, and especially on the long term, longer term. And speaking about the gut brain axis, I think that yes, we're interested in how GLP-1s or the use of GLP-1s affect behavior and what we eat. But it would also be interesting to see the impact of what we eat on our behaviors and how we on the plasticity of our preferences. And I think that one important component of it is the gut microbiome. And that we should not forget that because, we're also building that or modulating that with our diet. So like having these three components would be super important in terms of collaboration. I think we're very well equipped at UC Davis. And so there's a huge opportunity here.
a question back there. Yeah.
Hi, Nick Chafkin. So really wonderful presentations. I'm interested in, I've been having some cool conversations about addiction. And so the early results for GLP-1 said they're beneficial for things like opioid use disorder and alcoholism, which doesn't seem very weird to me, at least. So I was wondering first on food noise, except for the thing that you are craving, what's the difference between food noise and alcoholism and opioid use disorder? Or are they all just addiction? And then secondly, are there things about GLP-1s that are affecting brain chemistry that could then be kind of translated into addiction in general?
Yes, great question. As a nutrition scientist, I'm very hesitant to use the word addiction when it comes to food. I think it's a hotly debated topic in the literature. And what I'll say about food noise is we are just so early on in understanding food noise is while we can hypothesize that changes in food noise are occurring because of the same activation in reward centers in the brain that we see also in addiction to other substances or other behaviors. But it's still very early on to try and parse these out. But I mean, imagine if we did have that answer. Right. And if we could measure food noise in people who are not on GLP-1 medications, if we could extrapolate this to people who have been struggling with overweight and obesity for most of their life. And so it's fairly early stages, but I do think 10 years from now, we'll be having a very different conversation as more and more data emerges.
Justin.
So, I mean, I think, I guess, both Ameer and Julien, you showed similar plots. One of the things that was really striking to me was how, and I didn't realize this, how closely connected the emotional center of the brain is with the sensory center of the brain. Like when I say close, it's like physically they're right there together, which it makes sense, right? When we eat, we have these memories. It triggers a memory of some sort. And, oftentimes, particularly when we eat something that we particularly like, it's connected to a memory that we have that has almost an emotional sense to it. And I mean, I guess this definitely is a question for Caitlyn, but I'd love to get answers from all of you. It's kind of a two-part question. The first would be, if we have GLP-1s that are shifting that, if anything, diminishing that, does that make it so that we don't have those memories connected to our food anymore? And then, because I think that's something to think about, how do we turn that off? Because sometimes I want that Thanksgiving memory, right? Or that Christmas or Hanukkah or whatever memory you have. Like those are like deeply human memories that food activates and connects. And then the other part was for those users on the GLP-1 drugs, if they know that they're going to have these foods, that they want to have these like intrinsic, like hedonistic memories connected to, like, are there ingredients or foods or things we should be thinking about that would like almost activate those or counteract those parts of the brain So you can almost, force the brain to say, "Hey, remember this when you eat it."
Yeah, well, to the first part of the question, I think this is, absolutely critical. Again, we don't know, but smell especially, I mean, both taste and smell, but smell is deeply linked to episodic memory, long-term memory, what you've experienced before. So we don't know what happens when you're on GLP-1s. Is this association still working or not? I have no answer to that. We know that, for example, Alzheimer's patients, they keep long-term memory about the smell. So they remember smells from their childhood.
I mean, the only thing I would add is it really impresses me how the circuitries are connected. So the olfactory smells, right? This is where all your receptors are and you're sensing. But then the processing is in the piriform cortex, which is literally just stuck to the amygdala, right? So it's processed there, and then it sends an emotion or whatever you want to call it, the signal that's to the amygdala, which is this tiny piece of your brain with big feelings. and that's where it's stored, right? And that's where it ends. One thing that actually, I mean, this is a bit of a tangent, but what's peculiar to me is how visual memory is always better than olfactory memory. If I tell you, imagine this person, you could draw their faces in your visual cortex, but then if I tell you, remember that smell, you'd have a word for it, but can you really smell the smell again? You know what I mean? So it's a bit of a different type of perception here. But just to say that, yeah, maybe these drugs can, like Julien was saying, they might affect the rewiring of the circuitry for better or for worse. Maybe all of a sudden the chocolates you've been loving don't taste that good anymore, right? Or it can have the opposite effect. So we don't know. And these are really open questions that can be addressable only at UC Davis here. And I think we do have the bandwidth and expertise to really tackle these things from a neurophysiological sensory perspective, right? Because at the a reductionist way of looking at it, because we look at memory signatures, right? How electricity goes from the entorhinal cortex to like the hippocampus, and you form a memory and how you retrieve it. So we could, all these things can be applied in the sensory domain in the presence or absence of these drugs to understand these pathways better. So we should get on with it. Caitlyn?
Yes, it's such an interesting question. And I will say when we talk about food noise, typically we're talking about relief from the far end of the spectrum of food noise, of the intrusive, excessive thoughts. But to your point, there is also another end of the spectrum. We don't want to completely be muting our joy and our emotions and our love of food. I mean, food makes the world go round. It's why all of us are in this field. And so there is much more work that needs to be done. I'm excited to see what you two come up with in recent years. And the question that comes to mind for me as well is if we are taking advantage of this time period when patients are on GLP-1s, we're teaching them how to eat, they're developing new healthy behaviors. Are they able to engage in these behaviors as easily after potentially transitioning off of a GLP-1? Are they able to learn these new behaviors and stick with them afterwards? And only time is going to tell on that.
So we have time for one more question, and then I have a concluding question. So you can go ahead over there.
Thanks for the time today. So you talked a little bit about the preventative effects of GLP-1 on Alzheimer's disease and neurodegeneration. I'm curious, with the EVOKE and EVOKE Plus trials reading out potentially imminently on the treatment side versus the preventative side, what are your thoughts on that? Can you give us some kind of prediction for how you think those are going to play out? And then, if they are positive, what do you think the implications are going to be for that field and more broadly as well?
I mean, I'm really looking forward to the outcomes of these studies. For one, I never believed, with Alzheimer's, it's the plaques and tangles. I'm sure an outlier in the field. I think, these things are sort of the end product of a disease that's been ongoing for decades. So I think if the outcomes are positive, this would be one of a kind approach where we can use a drug to treat one form of dementia at least, And it tells you that there's other things besides the plaques and tangles, right, that have been targeted and with minimal effects so far and more side effects. So I'm psyched about it. I look forward to the results of these studies. And the last thing I want to point out is sort of going to the rewiring concept. For many years, people have been trying to rewire the brain, right? And maybe understanding the mechanisms of rewiring with these drugs is a good, if we learn from it, that's an opportunity to start to think about how we can rewire the brains. I know antidepressants, for example, one of the hypotheses as to how they work is rewiring and remodeling the brain, antipsychotics too. So this provides a scientific opportunity to learn as to how these drugs can rewire the brain, with or without these peptides, magic peptides that can interact with them. So there's opportunities here to learn from this and apply it in future for dementia, where you can think of it as a disease where there's a lot of dewiring. Can we rewire or prevent the dewiring with time? So again, also these studies are going to elucidate some of these mechanisms or touch upon it. So let's see. I'm looking forward to it. Wait.
Anyone else want to address that question? Or okay, so my final question, and Harold sort of started at this one, but I have never been involved in something where like there's so many I don't knows, because this has happened so quickly. It's insane, right? Like I mean, I shared earlier just what the market uptake of these medications are, and then all of these new indications for Alzheimer's. And, I love your question, Justin. Like there's some noise we want to keep and some we don't want to keep. And some of these medications are, it might be curative for Alzheimer's, yet at the same time, there was talk of like causing depression because we don't have the, the joy of things. So it's just, there's so much happening so quickly and we have so much to learn. So if you had unlimited funds, you could do anything you wanted to study as quickly as you possibly could. Caitlyn, I'll start with you. You could take this from the perspective of a dietitian or in your job in nutrition science at AG1. What is it that you would want to learn, or what would you want to study? What study would you like to see done?
Unlimited funds is really appealing. That's fantastic. I think I would want to hone in on the actual patient experience. I want to understand what behaviors are they changing, what changes in taste, what changes in smell are they experiencing, and then how is that relating to their overall dietary intake. And I would want to do that on a daily basis because, as we know, not every day on a GLP-1 is the same as the one before, and want to make sure that we're fully, just as comprehensively as we can, understanding the patient experience.
So giant longitudinal study on habits and perceptions.
Yes.
Love it.
Participants would hate it, but we would get all of the data that we need. So,
Julien.
Yeah, very much in line with that. I think I would love to run, intervention study with several groups and different diets, and healthy diets, but healthy and complex and diverse diets, and see how we can learn people to enjoy different types of diets and different types of sensory perceptions, and then how these effects will last. I would love to do that. And then, of course, as I said earlier, in relation to gut health as well.
Yeah, and I'd like to extend your study to Abby's question earlier and include people who are microdosing and going on and off of these medications. I think that would be fascinating. All right, Ameer.
I would tackle the rewiring question because I want to use that, learn and use it for brain disease in general. That's been like, the dream of a neuroscientist for ages, even in movies, right? And then the second thing I would do is I would still do this, try to discover which peptides in foods really tickle those receptors most, then take it, modify it, come up with a new drug that could, work more, work in the long run and maybe have less side effects. We'll see. But that's what I would do. I think there's a lot to learn from food that can be applied here.
Awesome. Well, I want to let you know, Ameer, that a bunch of us in this room are working on creating a Food for Health angel investment network. So when you come up with that, please see us. All right. With that, I would like to thank our panelists. And if you have any food noise, I'm standing between you and dinner. I think Justin has some concluding remarks. But thank you so much to the panelists. We can give them a round of applause.